Okay, so let's talk about the heart. We all know it's the hardest working muscle in the body, right? But have you ever stopped to think about how it gets its own fuel? It's an incredible piece of biological engineering, and today we're going to trace its very own dedicated fuel line.
So here's the thing that might make you scratch your head. The heart is literally full of blood, all day, every day. It's pumping it, it's surrounded by it. So why on earth would it need its own special delivery service? Well, that question leads us to a really cool biological paradox.
And this is it, the great paradox. Imagine you're a baker in a room just overflowing with flour, but you can't use a single pinch of it to bake bread for yourself. That's the heart's dilemma. The blood that's inside the chambers is just passing through on its way to the rest of your body. The actual heart muscle, the myocardium, is way too thick to just soak up the nutrients from the blood rushing by. It needs its own private pipeline.
So here's our game plan. We're going to start with that paradox. Then, we'll check out the main supply arteries, see exactly how they deliver life to the muscle, follow the blood on its journey back, and then, importantly, we'll look at what happens when this whole system fails. All right, so how does the heart solve its paradox? It has its own dedicated private highway system built just for the heart muscle. Let's dive into these main supply arteries. And this amazing system has a name. It's called the coronary circulation. You can just think of it as the heart's personal, life-sustaining plumbing. It's a closed loop, and it's designed for one job and one job only, to keep that heart beating. Now, what's really fascinating is where this whole system starts. It taps in right at the source. As soon as that fresh, oxygen-rich blood gets blasted out of the heart into the aorta, which is the body's main superhighway, the very first exit ramps on that highway lead right back to the heart muscle. The heart always gets served first. Priority number one. So that highway immediately splits, kind of dividing the workload. You've got the left coronary artery, the LCA, which people often call the main pipeline. It feeds the really powerful front and left side of the heart. Then you have the right coronary artery, the RCA. It takes care of the right side and the bottom, and, this is super important, it supplies the electrical nodes that actually regulate your heartbeat. Okay, so we've seen the main highways. But how does the fuel actually get from the highway to the front door of every single heart cell? Well, for that, we've got to zoom way in, down to the microscopic level.
So the journey goes like this. The big arteries split into smaller and smaller branches, called arterioles, and those fan out into this huge, tangled web of the tiniest blood vessels imaginable, the capillaries. This network is so incredibly dense that pretty much every single heart muscle cell has its own personal capillary right next to it. Talk about door-to-door service. And this, right here, is where the magic happens. This is the moment of exchange. In these tiny capillaries, oxygen literally hops off the red blood cells, passes through the super-thin capillary walls, and goes directly into the muscle cells. And in return, the cells hand off their garbage, their waste products like carbon dioxide. This critical handoff is the whole reason this journey exists.
But you know, a delivery is only half the story. Every good logistics system needs an efficient way to handle returns and take out the trash, right? The coronary circulation is no different. It's time for the return trip.
So let's meet the cleanup crew, the cardiac veins. After all that oxygen has been delivered, the now deoxygenated blood, which is carrying all that metabolic waste, gets collected by this network of veins. Their whole job is just to get this used blood out of the muscle tissue and back into the main system.
And all of these smaller cardiac veins, they all flow together, merging into one big channel called the coronary sinus. And this sinus dumps everything it's carrying directly into the heart's right atrium, which just so happens to be the chamber that collects all the used up blood from the rest of the body. It's a perfect, complete loop.
Okay, for our final section, we need to talk about system failures. We've seen how elegant and efficient this whole setup is, but that also makes it vulnerable. And understanding what happens when it fails, well, it's absolutely crucial, because the consequences are really, really serious.
So, the biggest threat to this system is blockage. Over time, these fatty deposits, you've probably heard of them, plaque, can build up inside the coronary arteries, making them narrower and narrower. This is coronary artery disease. It's just like a 4-lane highway slowly getting squeezed down to a single, traffic-jammed lane.
And look, this isn't some rare, obscure problem. Take a look at this number. About 1 in every 20 adults over the age of 20 has some form of coronary artery disease. That makes the health of these tiny, tiny arteries incredibly important to millions and millions of us. And this is the bottom line. If that flow of oxygen-rich blood gets slowed down too much, or worse, gets stopped completely by a clot, the section of heart muscle that artery was feeding starts to die from oxygen starvation, and that is a heart attack.
So let's just do a super quick recap of our journey. We started with that weird paradox. The heart is full of blood it can't even use. The solution? Its own private plumbing, the coronary circulation. It starts at the aorta with a left and right artery, delivers oxygen through a massive web of tiny capillaries, and then the cardiac veins bring the used blood back. It's a perfect loop. And as we've just seen, keeping that loop wide open is absolutely essential for your health. I mean, it's just an incredible system, isn't it? Working tirelessly every second of your life. It never, ever takes a day off. Which leaves us with one final and really important question to think about. Knowing how this whole thing works, and knowing what makes it fail, what can you do to protect your heart's own vital fuel line?